Hello, this is the video where it may actually be, I don't know, it's perhaps I can just say, even though it's such a cliche, health is really our wealth. It's too difficult. It's too difficult to think that we are now, it's currently August 14 while I'm recording this video, and the things that are happening right now around me, it makes it so difficult to imagine that these things are going to happen even now more than ever. The pandemic is taking so many lives, and it has been causing so many problems. Even a lot of people are actually having constant paranoia, including myself. Um, we always are in looking behind our backs, making sure that nobody is going to steal something as precious as our perfect health, physical health. Because once it's gone, it's really difficult to bring it back. Perfect health. It's a very, very difficult time for all of us. Now let's talk about the immunocompromised during the pandemic, some problems, as well as the stigma. Let's begin. First type of sickness that makes a person immunocompromised is cancer. Chemotherapy is an important tool to treat cancer. However, some types of chemotherapy can actually weaken the immune system of a person or the patient. So, patients and survivors even must continue to take their chemotherapy as directed by their doctor. Well, it is not advisable to change cancer treatment plan without discussing it with a physician. Also, people who had cancer or who survived cancer must always be watching out for fever. It is important that their temperature is taken anytime they feel warm, they feel flushed or chilled, fatigued, or if they just feel a general feeling of unwell. They need to call their doctor right away if they had this temperature of around 100.4 degrees Fahrenheit or 38 degrees Celsius or even higher. It is important that they know the signs and symptoms of infections, because infection during the course of cancer treatment, it can be very, very dangerous. It's very serious. So it's important that they have constant communication with their doctor, and that they tell them right away if they notice any sign and symptom of an infection. Now, it is also important that they find out if their doctor, from their doctor, if their white blood cell count is likely to be the lowest, since this is when they are at most risk for infection. If they have to go to the emergency room, it is advisable that they must tell the person who is checking them in that they are cancer patient. Okay, so they are also undergoing chemotherapy, because fever during chemotherapy, everybody knows in the medical field that it is a medical emergency and that they must be seen quickly. So, if there are any concerns about their chemotherapy or other cancer treatments, they must talk to their oncologist and with some primary healthcare providers. The next one is for people who received solid organ and bone marrow transplants, or even those who are using stem cells for cancer treatment. It is advised that they do not change or stop taking medicines without talking to their doctors, because stopping or changing their medicine, it can cause serious health problems. The next one is when a person is having genetic immune deficiencies. Well, yeah, some of us, they are born with, or they developed immune deficiencies due to genetics. Some of these include common variable immune deficiency, selective IgA deficiency, severe combined immunodeficiency, or even chronic granulomatous disease and complement deficiencies. If you take medicines, you must that are helping you boost your immune system, they must not change them or they must not stop them without talking to their doctors. Another immune deficiency is HIV. For a person who has who is infected with the human immunodeficiency virus, the risk of serious illness from COVID-19 is actually not yet known. But if you have HIV and then you have a low CD4 cell count and you are not undergoing HIV treatment, then you might be at higher risk for severe illness from COVID-19. If you are taking medications, do not change them without talking to your doctor. If you stop them kasi, or if you change them, it can cause the usual serious health problems. Currently kasi we're still learning about COVID-19, how it affects people with HIV. But based on limited data, we all believe that people with HIV who are on effective HIV treatment, they have the same risk for COVID-19 as people who do not have HIV. Ganun siya. Kung may HIV ka tapos you're undergoing treatment, kapareho mo lang ng risk yung mga taong walang HIV actually for the infection of COVID-19. Pero pag may HIV ka tapos hindi ka nag-undergo ng treatment tapos mababa pa CD4 mo, you are at greater risk. Okay? Older adults naman and people who are of any age who have some serious underlying medical conditions might be at increased risk for severe illness. It includes people who have weakened immune systems. The risk for people with HIV getting very sick is greatest in people, again, with low CD4 cell count and people who are not taking antiretroviral treatment or therapy, which is ART, antiretroviral therapy. Kapag hindi ka pa nag-undergo ng treatment, tapos mapapasad CD4 cell count mo, tapos may HIV ka, then that means you are at greater risk for COVID-19. Also, if you use oral or intravenous corticosteroids or other medicines called immunosuppressants, which are lowering the body's ability to fight some infections such as mycophenolate, sirolimus, cyclosporine, tacrolimus, etanercept, and rituximab, all of these, they will put you under greater risks of infections. So, generally, people with weakened immune systems are at higher risk of getting severely sick from SARS CoV-2. They may also remain infectious for a longer period of time, longer than others, but we cannot confirm this until we learn more about this new virus. This is CJ, and I hope that since it's August 14 already, I am hoping that we all stay safe, we all stay at home, we observe proper social distancing, we wear masks, and that we are always be following safety protocols for the safety of everyone and even ourselves. That's it. Goodbye, everyone.